Hello, hello, friends. Welcome, 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 and happy Sunday. Are here at PowerTime, live with Sharon Herbert, the Power RN, to you from Power in Nursing Innovations. Thank you for joining us again on a beautiful sunny Sunday here in Maryland. And we have, of course, news for you. I have been looking at many, articles related to nursing news, and we've always come up with something. So thank you for joining us today. And as you all know, I've been a registered nurse for a really long time, but I never run out of time for reading and coming up with ideas. So thanks for joining us. If you have any questions or comments, please put them in the box. And if you join us on replay, just please indicate hashtag replay. So let's get going. Oh, yeah, you all know. You can find us on Facebook, Instagram, LinkedIn, da 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 da. And you can always DM. So please do that and we will respond ASAP. So today we're going to talk a little bit about AI because AI seems to be in every facet of any organization that you can find. And so today I decided to look at a post that was indicating a speaker engagement. And I looked at it and it says, the title is AI in Healthcare. And I thought, I wonder what this is about. It was at a presentation for a nursing conference. And I said, I wonder what it says about nursing. So I'll read it. And as I did, I came up with questions. Questions. So, as we hear about AI, there are so many programs and so much that you can do using AI to solve problems. And we know we like to solve problems. So I was wondering how AI affects nursing. And as I came up, I'll tell you a few of the questions I thought about immediately. Is where are the presentations for nursing? How can AI promote or support healthcare providers like nursing? Because we know that AI is a program. But we also know that nurses are real people. So, what is this program, presentation, or article going to tell me about AI and real people, real human beings, our nurses? So, real people will be needed to implement the strategies or plans or answers or solutions, whatever you want to call it, that are created by AI platforms. Now, I bet many of you know that we've lost a few nurses, and probably well more than a few, during the recent COVID pandemic. So, as AI promotes all of these programs and strategies and solutions, creates them for you, who's going to do the implementation of all of these solutions? Now, don't you all don't tell me that I am the only nurse on earth that has thought of this question. We talk about plans of care. We talk about communication. We talk about staffing. We talk about not enough people, staff shortage. How is AI going to help us fix these problems? Because AI talks about solutions as in programs and strategies. Who will administer and implement those strategies, whether they're medications, trays, or care plans. Plans to lead to best practice and professional growth and best outcomes need people. For organizations, patients, and caregivers, including nurses, to be winners, because this is a win-win-win. The health system and provision of care should be a win for the organization, a win for the patients, and a win for the care providers. How's AI going to replace nurses? I thought, okay, that was my question. So I asked AI how AI can affect and enhance the practice of caregivers. So I thought, while I was thinking of the question, let me go to see what research or what articles are available. So I did find an article about the implementation of AI programs in healthcare. And one of the answers said that yes, AI can do some certain things. But we have to look at what we are seeking for our outcomes in order to determine whether AI will give us the answers that we're seeking or even be in the ballpark. So AI let me know that the work of caregivers, yes, can be affected by the programs. But we have to look at what the goals are for AI in healthcare. And it is to tighten up some of those loose ends, like late arrivals for medications and who answers the phone, some of those things. But you know what? Most of them still require people. And there are 4 aims for the healthcare systems. And we know one of them is improving the health of the population. So that's an overall goal. We haven't talked about who fills those blanks, but that's an overall goal. We want to also improve the experiences of those patients. Even as their outcomes may be, pretty good, we want them to have a good experience. So they have surveys that are sent to them upon discharge. And number 3, organizations are looking at reducing costs of healthcare. And number 4, they're looking at enhancing caregiver experiences. And that made me pause really quick, really quick. So what does it say about nursing? Does it say something about nursing really specifically? So I asked, and what about nursing? How do these solutions influence the caregivers? And I thought, so what about staffing? And I envisioned a challenge that relates to real people are needed to do this work. So we still need real people to do the work. And I envisioned, staffing ratios and the challenges that would connect with AI and the solutions, whether they can get things to you faster because you had a question for the physician, for instance, and AI could get to the physician quickly to get to the answer to order the medication that you needed for Miss Jones's blood pressure spike. The pharmacy gets it to you, zippity doo-dah, and you've got an admission. You got an admission in that time. Don't you need more people? AI can rally up some of the processes and programs, but who has to receive the item and implement the program or plan. That's a real person. And that's a staffing challenge. What do you think? What do you think? AI can generate information for you to make a decision and can give you the answer to the question, what medication you might need, and can get the doctor on the phone or on the text or whatever way of communication to order it for you. It comes and you can adopt the solution if you have four hands. If you have four hands. And if you had one less patient. And if you didn't have the admission. Who's going to help with that piece? So what about nursing is the question. I want you all to tell me what you think about how this will all work out. I can see it works out for some of the care providers, the pharmacy, the physician. How are we going to access the items? And how are we going to implement those solutions if we don't have enough people? I just think we've got to do something in concert with the rest of the team. And that's the place we're in still, now, already. We've been in this place for such a long time. Who asked us how this can work for us? And I have more research to do, so I want you to look at this question for yourselves if you haven't done so already. How can AI impact the staffing ratios? And who will look at that as, oh, well, we can quickly get answers to these questions. We can get these medications to the unit. And wow, that patient's going to be served and going to be saved. Everything will be great. And they'll have a great survey. CMS will look at all of this. That affects our financial status, of course. And everyone will be happy. Except for the overload on the side of nursing. We've lost so many staff in this years since 2020. And 2024, we have to remember that we've already existed in a place that's kind of upside down. We're not ready for faster, quicker, more influence of how everyone else can do things faster. Ask your colleagues, ask your supervisor. The future of nursing has already been plopped on us after COVID when we lost so many people. Imagine going from COVID and not enough staff and the career paths of younger folks. They're not taking all this overwork, overload. And baby boomers are retiring. Imagine going from not enough staff to a bulk delivery of medications for the patients that are already backed up on your plan for the day. Not enough people. Let's think about that. I'm going to ask you, it's power time now. What do you think the influence of AI can be on the unit where you serve and care for patients? I mean, write out an example. We've got a lot to talk about. 2024 is the year of change, and we've got to have a great impact on the future for nursing. Remember, it's March now. May is coming, and you'll have a few, we would like to say a boatload, but at least a few new grads coming. Let's make a plan for looking at the future. Don't let the future happen to us with no input and no impact of our experience and our feedback. So let's get together. Power in Nursing Innovations. AI is coming your way. It can do things faster, faster, and faster. And that might change your life. Let's go, let's go. And thank you for joining PowerTime today. AI is coming to healthcare. What do you think? Be well, my friends. I got questions for you. This is Sharon Herbert coming to you from Power in Nursing Innovations. As they say in boxing, get ready, get ready, get ready. We'll see you soon. Bye-bye now, and thank you for joining each and every time. We'll see you soon. Bye-bye.